Bismillahirrahmanirrahim. Today we will have case quiz number 101. Case data: 48 years old Caucasian male. He is hypertensive with past medical history of gastroesophageal reflux disease (GERD), irritable bowel syndrome, chronic headaches, anxiety, depression, chronic low back pain secondary to spinal stenosis status, post L3 through L5 laminectomies 12 years ago. The patient had end-stage osteoarthritis in bilateral hips treated by bilateral total hip arthroplasty or total hip replacement with metal-on-metal prosthesis 13 years ago. The patient worked in the construction industry for many years and performed daily tasks that resulted in his chronic hip disease, including heavy lifting and prolonged kneeling. Following the left hip replacement, his pain was vastly improved and he did well with no complications. However, following the right hip replacement, he noted increased bilateral hip pain, right more than left. 10 years ago, I mean 3 years after the hip replacement, he presented with hip pains, increasing confusion, headaches, blurring vision of about 2 weeks, and short-term memory loss. Radiological imaging was performed at that time but failed to reveal signs of joint failure. Blood cobalt level was drawn and returned 11.4 microgram per liter, and the normal is less than 1.8 microgram per liter. He subsequently underwent a revision of right hip replacing metal-on-metal joint with non-metal surface prosthesis. A repeat blood cobalt level was drawn after the surgery and returned to 5 microgram per liter instead of 11.4 pre-operatively. He remained clinically stable following the right hip revision, but few months later, he presented to an outside hospital after he sustained a traumatic fall in his basement. He attributed the fall to symptoms of progressive cognitive decline, including confusion, lethargy, short-term memory loss, and depression, which he noted had worsened since the first hip procedures. CT and MRI scans of the head didn't reveal significant acute pathology. EEG was also negative for seizure-like activity or any other pathological activities in the brain, and all other workups were essentially negative. So, what is the diagnosis? And as usual, we will leave you for 6 days and the answer will be online on next Thursday. والسلام عليكم ورحمة الله وبركاته وكل عام وأنتم بخير.